Good afternoon, everyone. So I'm going to tell you that I love being a nurse. I started nursing about 50 years ago, and no, I haven't had plastic surgery. I received a Nancy nurse doll when I was 5 years old. This was a doll with blonde hair that stood about this big, and you pulled a cord on it and said, "My name is Nancy. I can give you a Band-Aid. Do you need an aspirin?" I will tell you that in my nursing career, first of all, I've never wanted to be anything but a nurse. I have never been bored, and every day that I have been at work, I feel like I've made a difference. Okay, get started here. I want to start with a connect to purpose story. I was involved with the care of a patient in Carolina's healthcare system February of this year, was consulted to assist with discussions of treatment goals. Myself and a medical resident walked into the room, and the patient's daughter was there. We were meeting in a separate room outside of the patient's room because the patient was did not have the ability to make decisions because of the confusion that she was experiencing. We sat down, and the medical resident started with explaining some of the medical issues that this family member, that her mother was experiencing. And you'll see that everything that is listed up here on the screen and the slide are the terms that he used. And as he was concluding the explanation of what was going on with her mom, he said, "Do you have any questions?" Now, as I was listening to this explanation and felt my anxiety level getting higher and higher because I knew what I was going to need to do, I watched her face. And what I saw was frustration, I saw anger, and I saw fear. So when he said, "Do you have any questions?" before she could answer, I jumped in and said, "Would it be helpful for me to summarize a few things that you've heard today?" And she said, "Yes." So what I explained to her is that her mother had colon cancer that was diagnosed the year before, and that recently we discovered that her colon cancer had actually moved to her liver. And because of the presence of the cancer in the liver, her liver was not filtering the toxins in her blood as well as it used to, which was causing her confusion. I also explained to her that the decreased function of the liver had had a significant impact on her mom's kidneys. And that way, her mom's kidneys weren't filtering the blood or the urine as well as it should also. What we then talked about is the recent specialized x-rays that had been done on her mom's brain, and we had actually found a new site of cancer. And then I talked more specifically about what her mom would want us to do in the setting if her heart were to stop or if she were to stop breathing. And I explained to her that I understood the huge responsibility that she felt with having to make this decision, but I encouraged her to allow her mother's voice to speak through her, to be able to make decisions not on what she felt would be best, but what her mom would say if she was sitting there next to us. So when I finished, I asked if she had questions, and she said, "Yes. My brother and sister are going to be here in an hour. Can you come back and can you give this information to us again?" And I said, "Yes, of course, I'd be happy to." And as we were walking out, the medical resident was right next to me, and she leaned forward and she said, "It's okay for you to come, but I want her to do the talking." Okay. So I am privileged to have the person who I quoted here on the round table. This is Dr. Parnell. The reason I love this definition about health literacy is the word relationship. The relationship is not just how well the patient can take the information in. It's not just how well we can give the information, it's where that intersects. That's what's so important. For us to be able to give information to patients and to their families, to be able to enable them to exercise their autonomy in making decisions. So chronic illness. More than 80% of older adults suffer from at least one chronic condition, and nearly 90% of deaths involving patients over the age of 65 are directly associated with only 9 chronic illnesses. Now, it is very rare that I see a patient that has only one of these illnesses. They frequently have multiple illnesses. So chronic disease. I was able to adapt the information from the IOM of 2004, and again from Dr. Parnell's book, that looked at chronic disease and the fact that health literacy, what it has on health outcomes. It's a back and forth, it's a give and take. If patients aren't able to understand what we need for them to do in order to achieve their goals, because either they don't have the ability to understand or we haven't done a good enough job explaining it, it's going to have a significant impact on their health outcome. Actually both. But I will tell you, with palliative care, it also affects their autonomy. It affects their ability to give an informed consent. They need to be able to give an informed consent in order to exercise their autonomy for what they want and what they don't want. Okay, let's talk about the nursing workforce. Right now in the United States, as of March of 2015, there are close to 4 million nurses. Just in the area where we're physically located right now, between DC and Virginia, we have about 120,000 nurses. It's a little bit more difficult to pin down exactly how many of these nurses are involved in hospice or palliative care, but the Hospice Palliative Nurses Association has about 11,000 nurses, and there are about 14,000 nurses, whether they're advanced practice nurses, registered nurses, pediatric registered nurses, or LPNs that are board certified in hospice and palliative care. Okay, so nursing impact. We as nurses have the privilege to provide patient education and care to a diverse population across the lifespan in multiple healthcare environments. So where do hospice and palliative nurses impact care? We impact care in the acute care facilities, in hospitals, in the long-term acute care centers, in outpatient clinics. When I was at University of Utah, I saw patients with the pulmonary team, I saw patients with the rheumatology team, I saw patients not as frequently, but still sometimes with the bone marrow transplant team. Skilled nursing facilities, assisted living facilities, hospice facilities, at home, parish nursing, prisons, and community centers, specifically with education. So what are some of the challenges that we encounter every day? There was a study that's done by Dr. Roeder that actually found that patients recall and understand as little as 50% of what they're told by their healthcare provider. What I typically share with the patients and families that I see is that I am anticipating you're going to be able to hold on to 20% of what I've told you, which is why you're going to be hearing me repeat the information again and again every time that we have an encounter. This is because patients and families may be experiencing a lot of emotions at this time, inability to process some information, communication challenges, and frequently families, not every person in the family is on the same page or at the same spot of being able to accept or understand of what's going on with their mother, their father, sister, brother, their spouse. Sometimes we have challenges with interdisciplinary team communication, which is why I think it's wonderful that we have a panel representing that here today. And then also communication across the care continuum. The care continuum is anywhere from an inpatient setting to an outpatient setting. So a patient is admitted into the hospital. They're seen in the emergency room. They then go to a med-surg floor. Sometimes they have to make a visit to the intensive care unit. From the intensive care unit, they're back to the med-surg floor. They may then have to go out to an LTAC, a long-term acute care center, to a skilled nursing facility, then to home. It could be that hospice or palliative care has been involved at any spot of this. Again, it's a challenge to being able to make sure that we do a good job of communicating to the next continuum what we have started with this patient and family. So the role of nursing in education. It's about appropriate patient teaching that reflects developmental stages, their age, their culture, their spirituality, their preferences, and health literacy considerations, again, in order to foster patient engagement or patient autonomy. Now, the role of hospice and palliative nursing in health literacy. It's our frontline presence. We are there at the bedside. I will tell you in Richmond, Virginia, when I was there on a traveling nurse assignment many, many years ago, I walked into a patient's room. It was 2 o'clock in the morning. I was doing my rounding. I walked in and he was sitting quietly on the bed, and I could see he had been crying. And I sat down next to him and we talked about his fear of what was going to happen with his wife after he left. So I, as a nurse, had the privilege of being there and having that conversation at 4 o'clock in the morning. The universal approach, again, Dr. Parnell brings up in her book, we really need to look at health literacy as automatic as washing our hands. Any of us who walk in to see a patient in their room, we automatically know you wash your hands going in, you wash your hands going out. Wouldn't it be wonderful if we use the same approach with health literacy, that every time you have a conversation with a patient, in the back of your mind, we as nurses need to be reading, are they getting this? Am I conveying the information? Am I reading them correctly, that they're understanding things? Again, this has been mentioned numerous times, the interpretation of medical jargon, great evidence from the first slide that I showed. Our responsibilities with education and patients and caregivers, primary palliative care providers, and to facilitate communication with the interdisciplinary team members, with multiple specialties, with transitions of care, and through advocacy. So, how does the Hospice and Palliative Nurses Association help to advance expert care through health literacy? I'm going to let you read through this on your own. I will tell you personally what being a member of the Hospice Palliative Nurses Association has meant to me. It has meant a wonderful opportunity to help mentor me in my leadership. I have made wonderful contacts and have met wonderful mentors through the HPNA. Another example is I was on reading one of our special interest blogs, and I had a patient that had a condition called calciphylaxis, which is an extremely painful wound condition that happens with end-stage renal patients who have renal disease. And this woman did not want to take pain medication because she was the one in the household who balanced the checks. So I was looking for something to be able to help with her pain. On the special interest group SIG blog, someone talked about topical opioids. That prompted me to go do a lit search and be able to work with our inpatient pharmacy at University of Utah, create a compound that actually took the patient's pain scores from a 10 down to a 3 within 48 hours. So again, the HPNA for me, it has been a wonderful resource. So I'd like to now spotlight on 2 programs. One is regarding palliative care. This is with Carolina's healthcare system in Charlotte, North Carolina. I was with Carolina's healthcare system from 2011 to earlier this year, March of 2014. Carolina's healthcare system has an inpatient, outpatient, and virtual care programs. During my tenure there, we were able to have all of our patient education material reviewed and approved by the Patient and Family Health Educational Governance Council. Even to the point where we contacted a publisher who had a booklet called When the Time Comes. We sent this to the council, and they were actually able to make improvements upon it, which the publisher was more than happy to update their publication for us. There's also a tool on the website called Culture Vision, where any employee in the hospital can go in and, for example, type in end-of-life care for patients who are practicing Buddhists. And it will give that staff member more information about how to better care for that patient. While there, we developed a Providing Compassionate Care course, which is a 7-hour course. We were able to offer 7 hours of free CEU for nurses and interdisciplinary team members, based heavily on the LNET course. And we were able to, up to this point, educate over 900 nurses in primary palliative care. And then each one of the interdisciplinary teams at Carolina's healthcare system meet in a morning huddle to talk about the patients and to decide which skill set that our providers have on that interdisciplinary team can best meet those patients' needs for that day. The next highlight is a hospice program spotlight. This is for the Hospice of Western Reserve. Hospice of Western Reserve participated in a family caregiver project. It's a national education project which was an 18-month pilot study for oncology caregivers. The goals were to perform a needs assessment for caregivers, to do education, and to find out the impact that that had on caregiver confidence. The survey identified the need for core caregiving education, how to turn a patient in bed, how to assess if a patient is in pain, how to assist with activities of daily living. Once the education was performed, post-education survey found that a 75% improvement in caregiving confidence. The pilot also revealed the importance of educating hospice nursing assistants on how to identify caregivers' learning type and the use of adult learning principles. They were able to take that information that was initially based just for caregivers of patients with cancer and have now spread it across the rest of their population regardless of their diagnosis. So recommendations. We need to continue to be vigilant in communication training for hospice and palliative care nurses, physicians, and other interdisciplinary team members. For that matter, we need to increase the amount of communication training we're doing for all healthcare providers, regardless of their specialty. And current materials and resources related to health literacy should be revised to include content related to chronic illness and end-of-life care. The very last thing I'd like to share with you is this slide. This slide is an excerpt from a thank you card that I received when I was the director of the palliative care program at University of Utah. The program is now led by Holly Martinez, an advanced practice nurse, and Dr. Nate Warner. What was so powerful to me is that this showed me that we had done a great job in caring for this family. The excerpt reads, "Your team answered our questions before we knew we had them." And that was very powerful. What is so important for me to hold on to this type of thing, I have a file at home of thank you cards or letters from patients and families, is I don't keep pay stubs. They don't do anything for me. But at the end of a bad day, when I've had a rough day, I'll go through the thank you card file, and it does wonders for me. Thank you very much.